So we look around the world where suicide prevention strategies have been brought in. One great example is Quebec, where they had a really successful one, brought down the overall rate by over half, the youth rate by something like 80%. Very promising model. We can't do the exact same thing here. We have to build a model working with the most affected communities, with healthcare providers and mental health experts. But let's build a strategy that helps people feel a sense of hope, that nobody gets to that point of being so desperate, that early on identifies who's struggling and gets them counseling support, and that when people are in a crisis, that they're able to get help right away. Because right now, we see stories like Sam Alugo and many others who show up at the hospital and get turned away or don't get the kind of help they need and wind up losing their lives or seeing their situation get worse. That's why we're going to build dedicated mental health and addictions emergency rooms that give people the right kind of support at the same time as we take pressure off of our emergency rooms where people are already waiting far too long.
We're continuing to work on a number of fronts with a more of a strategic plan that will be based on our pillars of life, a document, our founding plan really for mental health and all too often subsequent addictions here in the province. That's a plan that has been endorsed by the Canadian Mental Health Agency, and a plan that we feel will really form where we go in this necessary conversation around mental health here in the province. When it comes to addictions, yes, you mentioned the reopening of the beds that were closed by the NDP in Estevan, the beds that are focused on not just addictions rehabilitation, but specifically on crystal meth rehabilitation, which is the first in the province in this day and age. And that is a great step forward for this province as well, and I would say a needed service that we need. The other day we announced an investment into 2 urgent care clinics in Saskatoon and Regina. Well, part of those clinics is going to be a segment that will increase the continuum of care that we offer in the way of mental health and addiction support, to ensure that we have that entire continuum of care for those individuals that are presenting with a mental health challenge or an addictions challenge.
I worked as a family doc for about a decade in the inner city here, and during COVID I've returned to work. I'm working at the Lighthouse, and the majority of my patients were struggling with addictions in one way or another. And now, with the drugs that are around, with crystal meth and with the heavy opioids, we're losing people. And it's terribly sad. We want people to get away from drugs, to have a better life, but if they're dead, they're not going to do that. And so we need to make sure that the programs are in place to help reduce the harm, reduce the likelihood that somebody's going to overdose when they're using drugs, but also that we've got substantial programs to get people off. And right now, people who are wanting addiction support often are told you're going to wait 3 months, 6 months before you get any help. Somebody's in that one moment where they're willing to change. We might as well be telling them, we don't care about you, there's nothing for you. We need to make sure that help is there right away, and that it's good enough and long enough so that people get more than just a few weeks of detox and then back on the streets, but actually get the strength and skills they need to stay off of drugs.
The mental health supports that we have in place need to be augmented and increased as we find our way on the backside of this COVID-19 pandemic. Not just those that have traditionally maybe had challenges with mental health and addictions, but also those that normally are just having challenges throughout this pandemic with the lack of opportunity for social interaction that we have had. And I've talked to many that are experiencing anxiety just due to the rules that we need to adhere to, and all of the pressures really that are on each of us as individuals as we find our way through what this global pandemic that, quite frankly, is the challenge of this generation. So as I say, the conversation around mental health and subsequent mental health supports, addictions, and the supports that are there today and the supports that we need tomorrow, this is an ongoing conversation. It's going to require a commitment from governments. It's going to require engagement with people across this province, and it's going to require ensuring that those conversations direct that investment so that we can achieve the outcomes that we are aiming for.